Hello everyone and welcome to this audio podcast. This audio podcast is part of a Papillae Sirocco series, an audio podcast as part of a Labostix Communicado, an audio podcast as part of a Squadron Kamikaze, an audio podcast as part of a Storm Labostix production. In this audio podcast, a little bit around around research, some research perspectives. So hemoglobin or HB is the most direct is one of the is the most direct indicator of clinical severity in hemolytic diseases. Its level may be close to normal values in mild forms. So anything in females in females anything more than 10 grams per deciliter, and in males anything more than 15 in around anything more than 12 or 15 grams per deciliter. At the same time, where it can be reduced, where the hemoglobin can be reduced, in moderate where in moderate where the hemoglobin is between 8 to 10 grams per deciliter, and in severe hemolytic diseases is where the hemoglobin is between 6 to 8 grams per deciliter, and very severe anything between 6 grams per deciliter. In a differential diagnosis, an acute onset is more frequently observed in red cell enzymopathies involving the pentose phosphate involving a pentose phosphate shunt, and in also immune hemolytic forms involving complement activation. Autoimmune hemolytic anemia caused by warm IgG and C mixed and cold agglutinin disease or CAD, with a thermal range close to physiological temperatures, close to physiological temperatures, and in paroxysmal nocturnal hemoglobinuria or PNH. And in the peer reviewed works in the peer reviewed works in the peer review works there is and there is again sort of additional information again in around the anatomical and histological bases around HUS. The additional investigation in around at least from a perspective that can be used or has been used historically is the glucose 6-phosphate dehydrogenase G6PD. Although in more recent literature and more recent works, G6PD the G6PD investigations are not do not really add as much to HUS hemolytic uremic syndrome investigation to hemolytic uremic syndrome investigations as part of the investigations in more recent evidences. Although for sort of for sort of investigate for those investigations to be a complete specialist can request a G6PD investigation in cases in cases where HUS is as part of the diagnoses. Again, investigations utilizing sort of cold agglutinin investigations can be useful, and investigations again, as mentioned in a previous audio podcast as part of this series, laboratory investigations such as the direct Coombs test, the DIC, a disseminated intravascular coagulation investigation, and the investigation around a D-dimer can be and are important alongside additional investigations such as APTT and PT, activated prothrombin time, and prothrombin time can be and should be utilized to help diagnose suspect peds or young people with Haemolytic Uraemic Syndrome. That draws this audio podcast to a close. This has been an audio podcast as part of a Papillae Sirocco, an audio podcast as part of a Labostix Communicado, an audio podcast as part of a Squadron Kamikaze, an audio podcast as part of a Storm Labostix production.